Department at Jackson College, Dr. Matthew Badtke. Good morning, Matt.
Good morning. Actually, former chair.
Former chair?
Yes.
Were you deposed?
We have 3-year terms as chair.
Okay.
And so my 3-year term was up starting this fall. So we have a new chair.
That's not on the ballot or anything.
No, it was actually a pretty amicable process. I was okay with turning that over to somebody else.
Oh, I'm sure. I'm sure 3 years is a.
It was a very odd 3 years if you think about when I was chair.
So that's crazy. Yeah, what a 3-year term.
Mm-hmm. Former science chair, Dr. Matthew Badtke. Who's the new science chair?
Another science faculty member, Jenna Pruitt.
Okay. Let's hope Jenna doesn't have a pandemic to go through.
Let's hope not.
Oh, it's still the pandemic, the COVID pandemic, and the Mayo Clinic said Jackson County is one of 5 counties in the state of Michigan that still seeing a bigger number of cases than the rest of the state, and that could increase as the weather gets colder.
Yeah, I was just looking this morning, and it looks like all of Michigan counties are either at the medium or low transmission level. So there's no counties that are in that high transmission level, so that's good. I think that we're going to see things fluctuate back and forth. Overall, if you're curious, cases are trending down over the last month. Hospitalizations trending down. Deaths are about flat nationally, which is pretty consistent with what we've seen, I would say, over the last 6 months or so. You'll see little, blips up and down, but overall, transmission is still fairly low. Still something to pay attention to, but now, of course, as we're getting into fall, we've got other respiratory viruses that are starting to circulate as well.
Yeah, let me ask you about some of those. My daughter had kind of a 2-week run. I know a lot of people have. Children are being hospitalized in the country at a higher rate. What are your thoughts on that? Do you think it has to do with children's immune system being secluded for a few years and getting back out, or what's your take on the RSV?
Yeah, I do think that's contributing to some of these rises that we're seeing. So something like RSV, which stands for respiratory syncytial virus. It's a very common respiratory virus for younger children. And yeah, the hospitalizations are up across Michigan. I was just looking. Several of the larger hospitals are seeing, 3-4 times the number of cases that they normally would see. And a lot of that probably has to do with the fact that, kids were not in school, we're not in daycares. We know that that's a big way that they get transmitted is when you get all these kids together. And then even over the last year or so, a lot of times they still had masks on, and now we're not seeing masking as much. So I think that just makes sense that there would be some immunity that wouldn't be there because of how things have been the last couple of years.
And for a lot of those, you really just have to wait it out with rest, hydration. Maybe you'll get antibiotics from the doctor, but not a lot of treatment.
Yeah, so RSV is the problem with that is that in some kids it can really get to the point where they're having trouble breathing and getting enough oxygen. So unfortunately, this was something we dealt with my son when he was about 9 months. He had a really bad case of RSV and was having trouble breathing. And basically, they just wanted to monitor oxygen levels and gave him supplemental oxygen and things like that. And that seems to be, for most kids, that's enough to sort of help them get through it then, is to just kind of supplement that oxygen. But, there's some kids that need even more treatment to deal with it. So it can be pretty nasty. I mean, my son was really sick with it, and I would say even for probably up to a year after that, whenever he would get any sort of any virus or whatever he would pick up, it would go to his chest, and he would be coughing and having problems with that. So it stuck with him for quite a while. So it can be tricky, but for the most part, you're right. It's just, if they're sick, keep them home, let them rest, and try to get over it.
Yeah, the hospitals in West Michigan, according to Cranes, are at capacity in their pediatric beds. So it's oxygen. That's what's happening in the hospital when a child with RSV that has to be hospitalized.
Yeah, what happens from ER to admission? Why are kids being admitted?
Well, I think, I mean, that, obviously not getting enough oxygen is a big problem, and struggling breathing and stuff like that is the big thing. So just making sure that, like I said, for my son, the big thing was just monitoring the oxygen saturation levels. So basically how much oxygen is actually in the blood and circulating through the body, and making sure that that's high enough. If it's not, then, then they might need to be admitted. Or for my son, he actually didn't need to go into the hospital. We just went to the ER and they dealt with it for a while, and then felt like, just monitor it at home. But for some kids that are still continuing to struggle with it, or oxygen saturation levels are not high enough where they need to be, then you might need to be admitted.
And of course, there are children out there with other ailments that, when they get something like that, it makes it 10 times more difficult as well.
Interestingly enough, I just saw this morning, actually, there's a new potential vaccine that might be coming out for RSV. So Pfizer is just completed a trial, and this is a little bit different. So actually, they vaccinated mom during pregnancy in the third trimester, and then looked to see whether it prevented RSV early on. And it seemed to have pretty good protection, about 70%. And that's really the biggest concern, is when the kids are really little. The first couple months is really when it can be most severe. Usually as kids get older, they have less likelihood of needing hospitalization or whatever. So kind of interesting thing. Supposedly might have approval by the end of this year for that.
So new vaccines, COVID, of course, now RSVP, on top of all the other vaccines that children are required to have. It's like pincushions now, where we've got so many things that we're protecting against. Is it because the various ailments and viruses are just more common, or what?
I think just the drug companies are getting better at how we produce these vaccines and what we kind of need to do. Again, the RNA vaccine for COVID, a brand new type of vaccine that had never been used before. So I think as we're just getting better about some of these newer technologies, I think you're going to see, supposedly Moderna and Pfizer have talked about this technology being used for other things. Maybe we can have a vaccine for HIV, or maybe we can have a vaccine, to help stimulate our cells to treat cancer. I mean, there's all kinds of potential things that you could do with this new technology. So I think we're going to see more things coming out, especially for diseases that are more of an issue, like RSV, that cause hospitalizations and make kids really sick.
You got maybe one shot, put all the vaccines in one.
Yeah, I've noticed a lot of new commercials on TV for some drugs, for some ailments that I've never heard of. When we see these commercials on TV, these side effects are always worse than the original ailment. Right. What do you make of a lot of the new, like when you see a new drug or a new drug hit the market, in a commercial advertisement?
Well, I think, it's just the sort of odd idea of, the importance of marketing in these things, and the importance of, it seems a little bit odd to me that they're trying to have people come into their doctor and say, hey, I saw this commercial for this drug, should I be on this? Which is sort of opposite of how you normally would think.
Right.
Sort of the doctor would say, oh, you know what, I see we have this problem, would you think about this? So it's just sort of a, just a kind of a different approach that you wouldn't normally think of,
Yeah, ask your doctor if Lovaco is right for you.
Have you ever asked your doctor if anything was right for you?
No, but...
Because I never can remember the names of them.
No, they needed some help in naming their drugs. I would name a drug like 3. You remember that?
There's actually, there's quite a process involved in that, and there's whole teams at pharmaceutical companies that their job is to come up with, because they have the drug name, but then they also have the trade name, which is sort of what it's known by. So a lot of work actually goes into.
Yeah, how do they come up with the generic or the trade name?
And I like the ones that say, ask or tell your doctor if you have diabetes. Well, your doctor already knows you have diabetes. You shouldn't have to tell the doctor. They've got your chart.
I guess.
That's true.
That is true.
Yep.
Oh, great to see you.
All right.
Thanks, man.
Great to be here.
The former science chair at Jackson College, still professor of biology and chemistry, Dr. Matthew Badtke. More of the morning show after this.